On this occasion, we want to recognize that we are here to celebrate hope. Hope for the citizens of Murray County, hope for the citizens of Columbia, hope for those in the surrounding areas that are in need of the types of services that we provide. We're grateful to the unique partnership that we've been able to establish between the TriStar Division of HCA Healthcare and the Murray Regional Health Division. This dream began actually more than 5 years ago, as the two organizations began to talk about how we could provide behavioral health services to the Murray County area. In just a few moments, I will ask Alan Watson, as well as Heather Rohan, to give us some background on the process of putting together such a unique partnership. But for me, this has really been an exciting process to be a part of. I've been in behavioral health care for a number of years, and for those of you who have ever had the opportunity to participate in building a new facility from the ground up, you know what a unique and special experience it is. And it's even more special because we know that the end game is to provide much needed care to the citizens of this area. As you get an opportunity to tour the facility, you'll get a sense of some of the unique features that have gone into providing care for our patient population. This is more than simply providing acute psychiatric services, but this has to do with giving patients and families, in some cases, even a new lease on life. Sometimes there's a dark tunnel that our patients perceive that they're in. And with these services, we can assist in providing some light at the end of that tunnel. The Murray Regional Health System's vision is to serve our region with clinical excellence and compassionate care. Similarly, HCA Healthcare's mission is, above all else, we are committed to the care and improvement of human life. It's the marriage of these two missions that Pinewood Springs aspires to put into practice every day with the care that we deliver to the patients that we serve. We'll live out these principles through the vision of Pinewood Springs Cares, meaning compassion, accountability, respect, excellence, and safety. In fact, the name Pinewood Springs itself is a testament to strength, resiliency, and refreshment. The pine, which symbolizes the strength and the resiliency. The springs, which represents the healing powers of water. We have chosen to put ourselves in position to provide both that strength and that refreshment. And we're committed to being assistive as a source of renewal for our patients. You'll notice that we've chosen light and calming colors, soothing and inspiring artwork, comfortable and safe furniture, bright outdoor spaces for movement and for reflection. These designs are not done by accident, nor did they happen overnight. There are many people who have been involved in the development of this environment. Very early in the design progress, our partners at our HCA Behavioral Health Service Line Division were instrumental in working with our architectural partners in putting together an environment that ensures that it was not only safe, not only secure, but calming and comfortable for the patients whom we'll serve. There are many individuals and groups who have worked tirelessly in this process to make this a reality. For all of those in the room and those who aren't in the room, we thank you for your efforts. We thank you for your contributions. We thank you for your presence. We thank you for your role in bringing this to reality. At this point, I'd like to take an opportunity to introduce Alan Watson, Chief Executive Officer of Murray Regional Health. Alan?
Thank you, Troy. For over 65 years, Murray Regional Health has been committed to the needs of our community from a physical standpoint. The dedication of our physicians, staff, and volunteers have produced excellent results in that capacity. However, on a daily basis, we see patients who would benefit from the treatment of the mind in addition to the body. Patients in need of behavioral health services frequently visit the emergency departments and physician offices throughout our region, and the need for these services is on the rise. In fact, over the past several years, we've witnessed a significant increase in mental health issues among our populations, and many of us have personally experienced these issues within our own families. This increased demand has led to delays in treatment and the transfer of patients for long distances away from their families where they do not have that local support. Several years ago, it became clear that in order to treat the whole person, Murray Regional Health needed to add behavioral health services to our system. Since this was not an area of expertise for our team, we were pleased when TriStar HCA and Murray Regional Health began discussions concerning the opportunity to work together on behavioral health services. HCA and their TriStar division possess 45 years of experience as a provider of behavioral health services, which makes them an ideal partner. In fact, two of their well-known facilities providing behavioral health services are located in Nashville at Parthenon Pavilion and TriStar Skyline Madison campus. Today, we're gathered to celebrate several years of planning, and as Troy mentioned and Charlotte and I were talking, we're not sure if it's 5 or 6 years ago, but a long time ago, we started the discussions about this facility, and it just shows how long it takes to get something of this magnitude approved, designed, developed, and built and ready for opening. But this was designed to achieve Murray Regional Health's dream of caring for the whole patient. I want to thank Steve Corbill and Charlotte Burns, who began working on this project all those years ago. And then after Steve retired, Heather joined the TriStar division and immediately saw the value in this project as she became president of the division. But not only Heather, but all of HCA's leadership and all of you within HCA who believed in this project and allowed it to proceed. We are very thankful. I also want to thank Troy and the entire HCA TriStar team for their work in making this dream a reality. Making the decision to start a project like this is not even half the battle. And it took a lot of blood, sweat, and tears to get us to this date. And so, Troy, thank you for your hard work. And then I'd like to thank our Board of Trustees at Murray Regional Health for investing in the lives of the communities we support. Murray Regional Health is here to support everyone within the southern Middle Tennessee region, and this is just one more way that we see our efforts to continue within this area. So thank you for being here today, and I hope you enjoy this great facility that you're going to see as we give you tours today. So thank you very much.
Thank you, Alan. At this time, it's my pleasure to introduce Heather Rohan. She is the division president of the TriStar division of HCA Healthcare. Heather.
It's good afternoon. It is a privilege to be with you here today. This is an historic day. It's historic. As Pinewood Springs begins to open, this began with a conversation between two healthcare leaders that wanted to find a way to do something better for patients and take better care for patients. You had leadership from HCA, our mission founded by Dr. Frist Sr., Dr. Frist Jr., and Jack Massey, to find ways to take better care of patients. Leadership from Murray Regional and Alan that, again, since 1953, have provided excellent service to the community here in Columbia. Leapfrog A, #1 hospital and care checks, so many accolades that you've achieved in quality. So getting together and having this idea about taking care of patients and taking care of very special patients, the mental health patients, the behavioral health patients we serve are some of the most vulnerable that we will have and that we'll find. We know in our country today, as mentioned, 1 in 5 people in our country experiences mental illness, and 1 in 25 people have a severe mental illness. So this is a nationwide crisis. I would venture to say that each and every person in this room has either loved someone, cared for someone that has been touched by mental illness, including myself. And so when we think about caring for our communities and caring for people, the creation of an organization, institution like this, a hospital like this, is so very important today. And yes, thousands of hours went into creating the beautiful facility that you see today and leadership. So the leadership, Troy, as the CEO of this organization, you've done such a great job of pulling a great leadership team together to do this. We're going to hear from Dr. Poling, who's provided that medical leadership and insight. Many, many people and faces in this room have been an instrumental part in seeing. I remember standing here last year on a windy day and shoveling dirt to open up to get things started. And it seems like yesterday, but I know it hasn't just been yesterday, but here we are today to open this facility. This investment, the investment that's been made by us together will last for many, many years, is going to care for so many people and help them heal. So this is what we work for in healthcare. What we're working for is for the person that walks through our door that needs us in whatever way that they need us. So we consider it is an honor and a privilege to be here today and to be able to serve the residents of this community. We thank you very much for that opportunity. And again, thank you again. We look forward to your leadership, Troy. Alan, what a great partner you are. And we thank all the community for being here today. Thank you very much.
Thank you, Heather. This time, it's my pleasure to introduce Dr. Rodney Poling. In addition to being the medical director of Pinewood Springs, Dr. Poling is a longtime resident of Columbia and a psychiatrist in the area for 30 years. Dr. Poling.
Thank you, Troy. Thank you, everyone, for being here. I see so many familiar faces. Thank you for coming and supporting our hospital. I'm Rod Poling. I've been here in Columbia now. I'm in my 30th year, and came here as a young psychiatrist drawn by Murray Regional. The time was Murray Regional Hospital, but as a few of you know, many of you may not, we had a psychiatric unit in that hospital that had been very successful for many years. We had a 14-bed psychiatric unit and an 11-bed chemical dependency unit. I see Dr. Brown back here, who shepherded our chemical dependency unit for many years. And it was very successful. Sometimes, I don't mean this in a negative way, but it's much like Otis and Mayberry. They'd come in and check in. We knew the people, we knew the families, we knew their children and grandchildren and grandparents, and it was a way to treat people in a wholesome and community fashion, which was the whole idea behind the Community Mental Health Center Act of 1966 or 65. But unfortunately, as things go, as Senator Hensley knows, politics get involved, and this little experiment called TennCare came in and kind of blew everything apart. I think it was an unintended consequence of choices made that disrupted kind of a system that helped our folks in Middle Tennessee who were suffering. And our unit closed in about 1997. And frankly, I didn't know what I was going to do. I had a practice, I had done inpatient, I did an outpatient. But fortunately, things have come around, and it's hard to believe that it's been, 23 years since we've had a unit. Starlin was our charge nurse when she was a teenager, you can tell. And it's so invigorating to have mental health come into the public eye and the public spectrum in a positive way. So often people who are suffering from mental illness, it's easy to ignore them. it's hard to ignore somebody bleeding in front of you or with a broken bone, as Lyndall mentioned in the prayer. But to ignore somebody who's homeless or severely mentally ill or suffering in silence is easy to do. It's easy to walk by and say, well, somebody else will take care of that. Well, we're here today. I'm thrilled with the team that Troy has built, and I'm excited to get going. I know we're going to be successful. We do need, if anybody knows any psychiatrists, we need a couple more, but I'm sure that will come. But I hope to reinvigorate the psychiatric and mental health community in our area. I think it's so important and an important part of treating the community here. So thank you all. They told me I had 3 minutes, and I told them I'd never spoken for 3 minutes in my life only, so I've probably gone over. Thank you for being here. We appreciate your support. We want everybody to be involved in supporting this. I do have another job at Unity, where we do have a geriatric unit here, but that's mostly for folks my age and older. I used to say I was a geriatric psychiatrist until I became a geriatric psychiatrist. But we're going to, for the first time in many years, provide care for adolescents, which is one of the most critical needs in our community and in our state, to provide a safe place and safe haven for adolescents who are experiencing crisis. We're going to be responsive to the adult community with mood disorders and certainly more severe psychotic disorders. So we are excited, and again, thank you for coming today.
Thank you, Dr. Poling. Dr. Poling's always recruiting. I appreciate it. At this time, we'll ask Carol Williams, who's with the director of the Murray County Chamber, to come and speak with us on just the impact within the Murray County area of this facility and its development. Carol.
Thank you. Thank you, Troy. I would like to also express my appreciation for everyone coming today. I think this is a testament to how excited we are as a community to have Pinewood Springs here in Murray County. I too, Dr. Poling, remember I've done, and we just are so appreciative of the partnership and the dedication to making Murray County and our surrounding area a better place and providing services for possibly people in the most need. So on behalf of our president, Mr. Evans, our board of directors, our ambassadors, and our membership, welcome to Murray County.